Hello, my name is Rob, and this is my post for this discussion board. I do sound sorry if I sound a little muffled. I'm still a little sick right now, but I will try my best. And for this week's discussion post for the team based and collaborative care webinars playlist, I chose the webinar that was titled as Better Primary Care for the People's Perspective, or from the people's perspective. They start off by talking about how to make an effective primary care system for for the public and basically the public eye. And one of the speakers talks about in her words, they needed to take a step back and see the patient's perspective, and they have the privilege of partnering with the United States of Care to make this happen. And they asked the patients, or all kinds of patients around any ages, what they value most when it comes to the primary care, and having them come up with different ideas to make primary care more accessible and more effective for patient satisfaction. The United States of Care uh, created a system where they basically make sure the U.S. citizens get accessible, quality health care, regardless of their social status, medical needs, or income. Many of the issues that were brought forth in this webinar are shortages, high clinician burnout, and practice consolidation and affordable barriers. Um, they used a national survey, I think you said back in 2024, 2025, um, and they used it to get more ideas from the public, mostly from the younger population and the adult population. And the national study, according to the webinar, in quotes, it says that most adults value and are satisfied with primary care. Access and affordability remain major obstacles. Young adults, rural residents, and people of color in particular face significant barriers. Um, and the topics that were brought up in this webinar do come to my attention a lot because they want to make the primary care system more effective for anybody and more affordable to people of all ages. Like, even if you're a fresh adult, like say you're 18, they want to make it more helpful towards them, especially starting to become an adult and being on your own. And they also help out the elderly, finding the help they need. And because a lot of me and my classmates are young adults, and I know it is different for everybody to find effective primary care services, but I think all of these concepts will help that situation for all of us for the best, so nobody will have any of these issues in the future. And this did change my way of thinking when it comes to the primary care system, because I did a discussion board not too long ago in this class about the primary care system, and I honestly had no idea that they had a national survey. They were bringing all the people around into this matter to help bring up ideas to help the primary care system be more effective, be more cost friendly, um, helping them basically come up with just major ideas to kind of make it easier for everybody else around and not just for certain people. But a question that this webinar did raise for me is, why didn't they implement this sooner? Why did, like, the primary care system has been around for 200 plus years, and an outside website has said it's been around since the 1800s. But they now, in the 21st century, have decided to give out a national survey to bring these ideas from the people. Um, I'm just wondering why they haven't done it sooner. Because phones have been around since the 1900s, so they had the technology to do that. I just don't understand why they didn't. And this webinar didn't really mesh with any of my past ideas because I didn't know that there was this side of primary care that cared about the satisfaction of the public. Like, obviously, they're all doctors, they want people to be happy and they want people to be healthy, but I didn't know they cared so much about the satisfaction of the public on what they want, what their ideas are, and trying to help make change of these issues. But they did decide to implement these surveys to get a view of the public, what the public wants. It's not so much what the doctors want anymore, it's more so what the public and the people want. But that concludes my video, and thank you for watching.